1383.
Thank you, Mr. Chair and members. Let me begin by thanking the committee staff for a very thorough analysis and by accepting the suggested amendments as well. Chair, you and I, along with various members of the legislature, attended the COP21 UN Climate Change Summit in Paris. What was clear from the meetings and discussions in Paris is that California is truly the global leader pursuing environmental policies to reduce climate change and address the sources that cause it. To date, these policies have mostly focused on reducing emissions of CO2, the most significant long-term driver of climate change. This legislative proposal represents the next step in those efforts to establish a goal to reduce short-lived climate pollutants that are both harmful to the air quality and significant climate forcers. These pollutants, including black carbon, methane, and fluorinated gases, are among the most harmful emissions to human health and global climate change. Although they remain in the atmosphere for a shorter duration than CO2, their impact is significantly more dramatic, hence why we will be calling them and referring to them as actual super pollutants and not short-lived climate pollutants. In 2014, this committee approved SB 605, which created a scientific report on short-lived climate pollutants, identifying major sources of emissions, as well as policies and strategies to achieve significant attainable reductions. As a follow-up to SB 605, the bill will implement that strategy with the goal of reducing black carbon emissions by 50%, methane by 40%, and F-gases by 40% by the year 2030. So why have we taken on this challenge? Because, quite frankly, we can't afford not to, members. This is an urgent need to develop a strategy to address and reduce these deadly pollutants. Extensive research links particulate pollution and increased ozone levels to severe and chronic health conditions such as cancer, heart disease, and asthma. These impacts are most profound in children. The reality is that the greatest impact of greenhouse gas emissions and pollution is often felt by the most disadvantaged and vulnerable communities in our state. Short-lived climate pollutants, especially black carbon, have a serious detrimental effect on air quality and public health. We need to implement and set a strong policy to reduce these toxic emissions. Members, I represent communities in Southeast LA County in the shadow of the 710 freeway, undoubtedly one of the most important transportation corridors in our country. My district is surrounded by railroads and heavy industry, and next to large port complex, a port complex in the country. It is a region that is identified by the U.S. Federal Air Quality Standards as one of the worst in the nation. We see in the children in communities we represent the impacts of chronic health problems caused by poor air quality, the result of heavy industry and choking, congested transportation corridors in the region. 1 in 11 children in LA County suffers from asthma. For black children, the number is 1 in 4. The impact of air pollution on children is not limited to just heart and lung problems. Asthma is now the leading medical cause for absenteeism in LA schools, impacting children's learning and development. Limited opportunities for physical activity due to respiratory illness and poor air quality also contributes to the epidemic of overweight childhood diabetes that disproportionately impacts Black and Latino communities. Although the problem is statewide, these challenges disproportionately impact poor families and communities of color. According to the 2015 State of the Air Report from the American Lung Association, the top 5 most polluted cities in the United States are all in California. A Southern California children's health study that examined the long-term effects of particle pollution on teenagers found that those who grew up in more polluted areas face the increased risk of having underdeveloped lungs, which may never recover to their full capacity. The average drop in lung function was 20% below what was expected for a child's age, similar to the impact of growing up in a home with parents who smoked. Reducing super pollutants in California will have an immediate beneficial effect, dramatically reducing the serious impacts these pollutants have on our air quality and on the health of our children. The issue of clean air, clean fuels, and achieving the state's ambitious carbon reduction goals is one of the greatest priorities facing our state legislature. I hope you would join me in this important fight for the health of our air and our communities. And I once again urge our legislature to once again make history in California. Thank you.
I want to be clear that we're only talking about anthropogenic black carbon. So all the carbon from the forest fires is not included. This is the stuff that we produce. So
Correct.
If there's any confusion, I will come back on some of the draft regs that the CARB has, some of the suggestions or proposals that are included in that. I'd like to scratch that out a little bit, but let's hear from your first witness.
Thank you. There we go. Thank you, Senator Lara. Good morning, Mr. Chair, senators. My name is Quentin Foster, and I represent the California Environmental Justice Alliance. We are a statewide coalition of grassroots, community-based organizations, and we represent well over 30,000 low-income communities all across the state. Our members work in low-income communities and communities of color highly impacted by pollution and socioeconomic stressors. Members, there are two reasons why this bill is so critical to environmental justice communities. First, there does exist a climate gap. Climate change hits low-income communities and communities of color first and worse. People of color are more likely to be nearest GHG emitting facilities with high emissions and co-pollutants such as particulate matter. Overall, people of color experience over 70% more PM emissions exposure within 2.5 miles of major GHG emitters than our white counterparts. Curbing climate change immediately is thus an issue of health for communities of color across California. Second, the pollutants that would be regulated by SB 1383 are directly harming the health and quality of life of the residents in these neighborhoods across California. These residents are environmental justice communities, otherwise known as disadvantaged communities, how we refer to them here. The senator mentioned the 710 freeway, where currently an average of over 1,000 diesel trucks per hour travel on the Long Beach freeway and emit black carbon, a super pollutant, through the communities of Compton, Paramount, Linwood, Southgate, Bell Gardens, Vernon, Commerce, and East Los Angeles, all low-income communities, where a majority of the residents are people of color. As a result, these communities are disproportionately experiencing negative health impacts. Ozone and particulate matter, both related to these super pollutants, lead to higher asthma rates among low-income communities of color, as evidenced by the senator's testimony. The rates of hospitalization and emergency room visits for asthma are more than 3 times higher for African Americans than any other racial ethnic group. And in California, there are currently 1.4 million Latinos diagnosed with asthma, greater than any other community of color in this state. In the San Joaquin Valley, which is overwhelmingly Latino, dairies account for 45% of California's total methane emissions. They are the leading source of ozone-forming volatile organic compounds and the leading source of fine particulate matter-forming ammonia emissions. The valley's ozone and fine particulate matter levels inflict a public health crisis on valley residents who are among the worst in the United States. And 1 in 5 children in the valley suffer from asthma. SB 1383 would take an important step forward to regulating these emissions. Senator Lara is correct in his assessment that we cannot afford to not take on this challenge. We believe that all Californians deserve the right to breathe, work, live, and play in an environment where your lifespan isn't predicated on your zip code and where access to clean air becomes the norm, not the exception. To move forward with an overall goal to address climate change without focusing in on the communities most overburdened is bad policy and misses a critical opportunity to address these super pollutants in a way that takes into account the very real adverse health impacts of our most vulnerable communities. We applaud the senator's leadership on this issue and look forward to continuing to work with him and all of you in addressing these very complex challenges moving forward, while also ensuring that our most vulnerable communities who experience the heavy burden of adverse health impacts are included in the solutions and are no longer left behind. We humbly request that you vote aye on this bill today and appreciate the opportunity to testify in support.
One of the things in the draft regs, I get that the EJ community has nothing to do with dairy digesters or oil and gas productions. But two things have popped out at me, and I'd like to have you inform the committee on what your strategies are for your community is removal and replacement of wood-burning stoves and also organic diversion from landfills. Everybody needs to do some, their food scraps. Whether you're poor or you're rich, people waste food, and people put it into the regular garbage, right? Rather than putting into the green bins, or they have a fire because they like having the fire on a winter day, right? Can you tell me the strategy that you as the EJ community or as spokesperson, what are you guys going to do within your community to do your part, right? I know you're adversely affected, right? But they're also part of the solution.
Absolutely. I think one of the things that we have committed to within SEHA is through education outreach to those communities, advising them of some of the dangers and some of the harmful effects of some of these practices. The other thing that we are critical in doing is engaging with our regulatory agencies and ensuring that there is a connection between some of the decisions that are being made there and that outreach includes these communities so that the education outreach is critical and it reaches our communities as well. And so through education, us working through our community-based organizations on the ground, informing those inhabitants who live in these environments of these practices and how harmful they are is critical, but also to working with our regulatory agencies to ensure that they are also promoting outreach into these communities when it comes to trying to determine what is the best course forward are also critical. Those are the strategies we are
Get to
employing.
Senator Laura. You weren't here before when I was talking about the emergency management of in Victoria, Australia. But the code words were "we work as one." So if I want to improve the situation in the whole state, and we want to work together, we're doing our fair share too on what we can do with our food diversion and wood burning stuff. It's not a big piece of it, but it's part of the outline. Senator.
I agree with you wholeheartedly, Mr. Chair. We've had many discussions. This is why we're trying to leave this bill as broad as possible to allow the ARB to come up with different strategies. One of the issues that we haven't mentioned too is also fireplaces. And what is the strategy moving forward when it comes to regulating new developments in terms of fireplaces? We know that's another major source. And big supporter of organic diversion of our food waste. I mean, we have to do much more to, kind of close that loop. And then also work on strategies to change people's attitudes when it comes to separating their waste. We've been to Sweden, we've been to Australia where, since a very young age, people are taught to separate things further than what we have done. And so I think there's many more strategies we can do. I want to reiterate that these are all strategies that can be used and can be looked upon to meet the new target set by this bill. I don't want to get too prescriptive on what to do because I want to be able to allow industry to work creatively with the ARB to get these targets done.
Next witness.
Good morning. My name is Dr. Bruce Bakar. I'm a volunteer physician with the American Lung Association in California and one of its 32 Doctors for Climate Health. I recently left my career as an obstetrician caring for pregnant women to helping try to save the sickest patient I've ever met, which is Mother Nature. I give frequent presentations in San Diego on the health impacts of global warming, and I serve on the City of San Diego's Climate Action Plan Implementation Working Group as the public health representative. The medical community is united in support of this bill. Before you today is a letter signed by 33 health and medical organizations recognizing the need to set ambitious targets for short-lived climate pollutants. These superpollutants, as has been described, include black carbon, methane, and fluorinated gases are the most harmful emissions both to global climate change and to human health. Methane is 86 times as potent a greenhouse gas as CO2, and black carbon is thousands of times worse. On Monday, our administration released its latest climate change and health assessment. It painted a very grim picture of a future without climate action, one in which air quality is degraded due to rising temperatures, ozone, drought, and wildfires. Heavy rains are more frequent, heat waves are hotter and last longer, hurricanes become more severe. This will have disastrous consequences for public health, including worsened symptoms of lung disease and other chronic illnesses, higher risk of heat exhaustion and often fatal heat stroke, new threats of food and waterborne diseases, and increased hospital admissions for cardiovascular and renal or kidney disorders. Our most vulnerable citizens, as mentioned, will be at highest risk, and the World Health Organization recently announced in a statement that 88% of the disease burden from climate change will be suffered by children under the age of 5 years old. And of course, they bear no responsibility for these impacts and will suffer from them for the longest time. As sobering as all this is, the science is clear. Communities in California and across the nation are experiencing the health impacts of climate change right now. The American Lung Association's 2015 State of the Air report shows that 5 California cities top the list for the most polluted regions in the country. Air pollution prematurely kills more than 7,000 Californians every year. And right here today is a case in point with this out-of-season heat wave. Air quality will deteriorate, and children in Sacramento with asthma will be more likely to be rushed to an emergency room, as will adults with pre-existing heart or lung disease. There will be more missed school days and more missed work days, and deaths from asthma and heart attacks until the heat eases. This will happen every time we have a heat wave. Science tells us that aggressively lowering superpollutants is perhaps our best chance to slow global warming, protect human health, and save lives. SB 1383, with its unique focus on these pollutants, will do exactly that. Having been a doctor for nearly 30 years helps me understand the risks that a destabilized climate poses to all of life on Earth. On behalf of the health community, thank you very much for your attention to this issue today, and we urge your support of this bill.
Others in support of SB 1383, come on down.
Good morning. I come from Los Angeles, and I prepared a 3-minute presentation, if that's all right with you all. Good morning. I'm Rochelle Reyes-Wenger, Director of Public Policy and Community Advocacy. On behalf of Dignity Health, I'm grateful for the opportunity to testify in strong support of SB 1383. I want to give a little background and context to why I'm here. As the largest private not-for-profit health system and Medi-Cal provider in the state, we have 32 hospitals and over $17 billion in assets. We provide integrated patient-centered care to more than 5 million people annually here. Dignity Health is an economic engine in the communities that we serve, partnering with over 59,000 employees and 9,000 affiliated physicians. In fiscal year 15 alone, we provided $2 billion in community benefits and care for the poor. We are committed to strong activities and work inside and outside our hospital walls to steward our resources while meaningfully advancing effective, common sense solutions that will address social, economic, and environmental determinants of health. Our healing mission really recognizes that we cannot have healthy people and healthy communities without a healthy planet. We must especially care for the poor and vulnerable who are disproportionately impacted by climate change. We join in solidarity with others who call for bold climate leadership and the need for ambitious targets to quickly reduce black carbon, methane, and fluorinated gases. We know that these are the most harmful emissions to both human health and global climate change. California's leadership is truly critical, and not only to our ability to protect our patients, but also to protect our bottom line. Climate change is already putting a strain on the U.S. healthcare system, and the strain will only worsen as temperatures increase. The newly released White House report further highlights the science of what we already know. The urgency is here and now. Health threats are real and felt by so many among us already suffering today. We need to act boldly. The health of our communities really depend on our collective efforts and success. We've been experiencing climate change impacts throughout California, and we have felt it so very much within our hospitals. We've witnessed firsthand during recent storms that were fueled by the drought in California, where entire towns were engulfed by flames, and people looked to us to be the beacon of stability. And so we ask you to really look at this bill very carefully and to help us move it forward. We know that the impacts to asthma is so very great. In California, asthma costs are estimated at $11.3 billion per year due to healthcare costs and lost work and school days, including $1 billion in hospitalization costs alone. This is why we are here today to really stand behind this bill to use our scale, our resources, and reach to influence climate policy and action. We're here today to urge you to support this important bill, and we look forward to working with Senator Lara and others to move this bill forward. Thank you.
Think Dignity Healthcare. Next.
Good morning. My name is Kyla Aquino Irving, and I'm with the California Medical Association Foundation. I represent the over 50 ethnic networks of physicians in California in strong support. Thank you.
Morning, Mr. Chair, members. Justin Milan. For a number of our clients, we're here in support. The California Compost Coalition believes that that is a way to help address this issue. The local environmental health directors are part of a very, very large, growing public health group also in support. So U.S. Green Building Council sees this as a critical issue as well. So for those three clients, we urge your support of this bill.
Thank you.
Teresa Bowie with Californians Against Waste and strong support. This is especially important in the waste industry, where the waste sector, where California's landfill emits 3 times as much as Aliso Canyon every single year.
Okay. Thank you for plugged in.
Corey Bullis on behalf of Environmental Defense Fund in support.
Thank you.
Kimberly Chen on behalf of the California Pan-Ethnic Health Network in strong support in our drive out.
Bill McGavin, Coalition for Clean Air, strong support.
Andrea York, Clean Power Campaign, strong support.
Emily Resch with CalPERG and strong support.
Vincent Morat-Maggio with Bloom Energy and strong support.
Tim Gibbs, American Cancer Society, Cancer Action Network, and support.
Danielle Kaiser on behalf of Common Sense Kids Action, on behalf of our 65 million users worldwide. We are in strong support of this bill.
Tom Addison with the Bay Area Air District, here to speak in strong support of the concept and looking forward to continuing conversations with the author's office to make it an even stronger bill.
Jenna Price on behalf of the California League of Conservation Voters in strong support. Thank you.
Juan Altamirano on behalf of Audubon, California in strong support.
Okay. Is there anyone here who's opposed to this legislation? Perhaps you could come forward. If you... Mr. Manning, good morning.
Good morning, Mr. Chairman, members. Ed Manning with KP Public Affairs on behalf of the Western United Dairymen. This bill, I think, and having talked to Senator Lara pretty extensively, is well-intentioned to deal with an issue that I think many of us believe we can make some progress on reduction of certain types of emissions. But I think it's important to set the table here, because having listened to the testimony of some of the proponents, you would think that there is no regulatory framework in California for air emissions. In fact, particulate is regulated, NOx is regulated, SOx is regulated. California has been the leader in air pollution control in the country for decades, and the results of that, I think, should not be dismissed. The improvements in air quality throughout the state, I think the South Coast Air Basin is no better place to look, have been really incredible in a matter of 2-3 decades. And there's also a greenhouse gas law, lest we forget, AB 32. And so one of the challenges, I think, for this bill is that it's not clear how this bill interacts with those other frameworks and regulatory authorities. So in particular, the AB 32 says to get to 1990 levels of greenhouse gas emissions by 2020. This bill sets new goals and an extended timeline. And so we really don't understand, I think, very well how this fits or doesn't fit in. The other thing that is of concern is I think the proponents were very honest and forthcoming of what their intent is, which is regulation of the dairy industry, which I'm here to talk specifically about that industry. The dairy industry is 99% family owned and operated. Dairies tend to be in more rural areas for obvious reasons. Nobody would, I don't think, want them in industrial parts of the city of LA or elsewhere. And California dairy is actually a major industry and the largest dairy producers in the country. But the folks in the dairy industry are not chemists, they're not engineers, and their challenge really is to produce a healthy product and keep cows happy and productive. The byproduct of their efficiency in California is that and the CARB report acknowledges, our greenhouse gas footprint here is actually very good comparatively. And that's not by design in terms of reducing emissions per se. It's because of efficiencies in terms of the type of feed we use and some of the technologies we've developed to make the dairy operations more efficient. Having said that, the notion that you can regulate your way to significantly reduce methane emissions from dairy, and there's two sides. There's enteric emissions, which accounts for 20% of the inventory. That's what comes out of the cow, belching, et cetera. CARB's goal right now in their report is a 25% reduction. Well, there is no magic Pepto-Bismol for, cows. And so the notion that you can just create a regulatory mandate without technological or economic feasibility is really putting the cart before the horse. Similarly, the 25% of emissions are from the manure management side. There are technologies that are being developed to try to deal with that, and we're at the forefront of trying to do things that some of the technologies that have been mentioned, like dairy digesters. But dairy digesters are limited in their ability to be used. Some of them have worked better than others. The only place where you have significant digester operations is in the Sacramento Municipal Utility District area. What are the challenges? Let me just go through them. One, you have to, if you're going to have a dairy digester, you're going to have a market for either electricity, because you can combust a generator, create electricity. For that, you need air permits, which you can't get in most of the Central Valley. Second, even if you could get the air permit, and this is all acknowledged in CARB's report, you need someone who's willing to buy the electricity at a price which is not competitive with solar or other renewables. There is no such mandate. The other alternative is you could try to make a fuel. The fuel, and Mr. Urban will talk about this from the landfill perspective, but the fuel is extremely expensive, and there's this other problem, which is how do you get it to where it can be consumed? Dairies are in rural areas. There are no pipeline infrastructure, and you're seeing this on the Aliso Canyon issue right now. We don't have a lot of ability to put a biogas in pipelines. There's no infrastructure. So the challenge of getting it to be affordable and then getting to where it could be consumed and getting someone to pay for it is a huge challenge. Similarly, composting. That's another idea. Turn the manure into compost. We need a market, and we need better technology to be able to do that. The only way that could happen is not through a regulatory framework that is a mandate. The state needs a comprehensive plan, like it's done on other major infrastructure. A commitment, CDFA says just for digesters you need $100 million a year for 5 years. Composting and healthy soils would need additional funding. And it's not just digesters, it's technologies called scrape, which was mentioned in the analysis, solid separation, et cetera. And even then, after that investment, and assuming you could build out some of this infrastructure, and you could start to scale a market, it's not clear how far we can get. If we do that, then I think it's fair to say at the end of that, have the dairies done their part? But to sit here now and create a mandate, it would have poor unintended consequences. For example, if you look at the census tract data and the wages paid by our industry, we're in underserved communities. That's who our workers are. We pay more than minimum wage. Our dairy workers get significant year-round income. And the other piece is that we've lost 50% of dairies in California in the last decade. Milk production is down the last 3 years. And milk prices are set independently by the California Department of Food and Agriculture. So you can't just readily pass costs along. And what's going to happen, and it's acknowledged as well in the report, is leakage. California dairies are being recruited by North Dakota, South Dakota, Wisconsin. They come to the big show, farm show every year, the governors of some of those states, to try to recruit California dairies to those states. And if California dairies leave, then we lose the opportunity to do the creative technological development that we could do with the right investment here. So for those reasons, we would encourage the author to look at how to get the right agencies together with the private sector to do an infrastructure investment plan and make that the feature, at least to some of the agricultural side of this bill. Now, it affects other industries as well, obviously, because we think the failure to do that will have consequences that we know the author doesn't want, and we don't want either, because California dairies are family-owned and operated, and they want to be here for the long term. So with that, thank you for allowing me to provide that testimony.
I'm Gene Urban. I represent Waste Management. I believe Waste Management is the largest environmental service company in the state. I believe no one has collected, transported, diverted, composted, recycled more material than Waste Management. We need amendments in this bill. Let me just take a brief moment to explain why. In 2014, less than 2 years ago, this committee approved the bill by Mr. Chesborough. My client supported it, so did the solid waste industry. Requires 50% diversion by 2020. Took a thoughtful, measured, incremental approach, assessing the various costs and impediments and difficulties, including, Mr. Chairman, the inclusion of food waste, which is a putrescent and has pathogens and is not the same as Christmas trees. It gave predominant regulatory authority to CalRecycle, which has some familiarity with our industry, including franchises, ratepayers, and the manner in which large investments are recaptured over time through the rate base. 9 months after that, in September of last year, CARB adopted its draft plan, which ignored AB 1826 and imposed a preliminary requirement of 75% diversion by 2020 and 90% by 2025. So is it permissible to use the word absurd in Senate Environmental Quality Committee? Because the proposal is absurd. It's asinine. It's not going to happen. It's unrealistic. It's impractical. It would be enormously expensive. And your constituents and ratepayers would have to pay for it in the absence of markets and all the other difficulties that Mr. Manning described. So we are now confronted with what was, at the time, a very ambitious objective, 50% diversion by 2020. We knew there was an aspirational element in there. We knew that. CARB apparently doesn't care. 75% by 2020, 90% by 2025. We're opposed. We can't make it. It's unrealistic. This bill compounds that problem. It gives CARB blanket authority to go after methane. There's no acknowledgement of 1826, no reference to it. Does it expunge it? Does it erase it? Does it just sweep it away? Who's in charge? Is it CalRecycle or is it CARB? And with all due respect to the author, for whom I have enormous respect, the bill says it's the intent of the legislature that there be consultation among agencies. Well, I don't care. My client can't rely on that. My client needs an active and informed partner if we're going to get to 50% by 2020. We can't tolerate broad, uninformed delegations of authority to CARB contrary to the statutes that you voted for. that you supported less than 2 years ago. It doesn't work that way. Why in the future would we negotiate with the legislature if 18 months later you simply adopt the bill that says, ignore that, go talk to CARB? My problem is representative of all the other people lined up behind me. There is a large body of law, some of it industry specific, some of it general. There is a large body of law. Some committee, someplace in this House, has to try to integrate that, has to try to rationalize it. You can't just layer another broad delegation of authority atop other recently enacted and very industry-specific laws. My client is aimless. It doesn't know what to do. So with that, we are opposed unless amended. We would like the amendments to say, no, the solid waste industry is outside this bill as it relates to methane. The greenhouse gas recycling emission reductions that have been previously enacted by the legislature are to be pursued by CalRecycle, not CARB. There are other people lined up behind me who have the same difficulty. Someone has to slow this down and begin to make informed judgments about which is the leading entity and what are the realistic goals. Do you have confidence in CalRecycle or not? The way I interpret this bill is you have no confidence in CalRecycle and you have implicitly rejected the very bill you just adopted 2 years ago. So on that basis, my client is opposed. If amended, we will continue our pursuit of 1826. But if this bill is enacted, we're aimless. We don't know who to talk to anymore.
Well, the author did accept the committee amendments, which prior to any approval of a strategy, they have to have regional hearings. They're going to coordinate with state. They best evaluate the scientific information technology. There's sort of a pause before we go into the strategy. But I got your...
We have statutory directives, which, based on my limited understanding of California law, take precedent over regional hearings by a regulatory agency pending regulation. We have statutory objectives that we have to pursue. Ironically, the first one was April 1st. That's the first measured incremental performance under 1826. So, no, I don't believe those amendments are responsive. You have conflicting statutory directives. This won't become effective until 1/1/17, and it gives CARB broad authority to pursue methane reduction, which is the very objective that 1826 is after, which is to divert organics from landfills so they don't generate methane in the first place.
Thank you, Mr. Urban.
Thank you.
Others opposed? Let's hear it. Oh, wait, sorry.
Because thank you. I appreciate your testimony, and I'm trying to figure out what is the solution in terms of CARB and their authority, and what would you recommend in terms of, it seems to me there ought to be accountability, transparency, and legislative oversight of any bureaucracy of unelected officials that determine how statute is implemented within the state of California. So my question to you is, how do you get that accountability?